There's a new complication with the use of semaglutides for weight loss that we should be concerned about, and that's the development of a DVT or a deep vein thrombosis, better known as a blood clot, usually of the lower extremities. It was found out quite by accident. A study was done called a comprehensive analysis of the safety of semaglutide in the treatment of diabetes type 2. They were looking for serious adverse events, and they certainly found one. The development of a DVT was increased 266%. But why? It's probably a mixture of the drug and some of the physiological effects that the drug causes. For instance, people who had chronic diarrhea became chronically dehydrated, increasing the viscosity of the blood, and that increased thickness allowed for clot formation. They found that the fibrinogen and thrombin levels were altered, probably by the glycogen-like protein in the semaglutide. They found that the risk of developing a DVT was increased also because platelet activity changed. So these are all risk factors that we have to be concerned with, especially in the obese population. Now, if you develop a DVT, there's a concern that it could break off and then go to the lung. That's called a pulmonary embolism, and unfortunately, it's often fatal. So how do you know if you're getting a DVT or if you formed a DVT? First off, that leg would usually swell. It would become very tender and warm, usually around the calf. Any lifting of the foot upwards would cause a lot of pain. That's called the Homan sign. And if you have any of these, you should get that checked right away. Now, if you get a pulmonary embolism, that's a little different. Now you've broken off a piece of the clot and it's gone to the lung. You'll get a sudden chest pain, usually a sharp chest pain. You might start coughing, even cough up some blood. You'll become very short of breath and tachypnic. In other words, you'll be breathing greater than 20 times a minute. It's very important, again, to get checked. Sometimes you could break up that clot, other times it will resolve on its own. But if it's large enough, it could be quite fatal because it's going to affect gas exchange. You're going to become hypoxic, cyanotic, in other words, become kind of bluish purple, and usually that's the fatal type. So we're working on this as to what actually is causing this increased risk of clot formation. It's probably going to be a mixture of both the semaglutides and the physiological changes. This is really also new that it's not even in the package insert yet. So if you're on this medication, especially if you have risk factors, obesity, congestive heart failure, make sure you're aware of it and get checked right away.